I'm Dr. Alpha Stewart, Senior Associate Dean for Community Health Engagement at the University of Tennessee Health Science Center. Getting vaccinated will help us all get back to some semblance of normalcy. Memphis and Shelby County, get vaccinated. It's our best shot.
Hey y'all, we are hanging out in the beauty shop, the hair salon,
yes.
sanctuary, whatever you want to call it. We're going to have a little shot talk, and that is being brought to us today by City of Memphis and Blue Cross Blue Shield. I'm Ashley Williams with GJC Publicity. I'm going to let you ladies also introduce yourselves before we get started.
I'm Latricia Adams, President and founder of Black Millennials for Flint.
All right, well, I'm Tierney Dandridge. I am a nurse and owner of Acacia Rentals here in Memphis.
Okay, I'm Catherine, and I'm a doctoral student at the University of Memphis.
All right.
Let's go Tigers.
Yes. So, like I said, we're going to have a little candid COVID-19 conversation, looking back on the pandemic, also talking about right now with a specific focus on vaccinations, as this is the Shot Talk. So to get us started, let's walk back thinking the full experience and how it's affected our community. You can speak very openly, positively, negatively. How has COVID-19 affected our community?
Oh, it's been tough. It's been real tough, especially I know for the medical field, for one, seeing that whole transition with having a mask up, gown up, you couldn't touch patients, you couldn't touch people, family members couldn't see their loved ones, and it's like, you can, but I can't, that's my mom, or that's my dad, or that's my aunt, you know, but we could do it, and it was different for them, I know too, with them seeing us dressed up like that and having to have that whole experience, because they're the elderly population that I work with. So a lot of them have been through something like this and we haven't. So they were able to talk to us and get us through it a little bit, but it was still very difficult, especially at work for me.
I can speak to it from an education perspective. So one of the things that we have seen, unfortunately, with our children, one is learning loss with just the digital divide. So I think one thing that was a misconception is that youth are able to manipulate and use data and technology, where in some ways they can, but not from an instructional technology perspective. So we saw schools trying to operate like they never had before. You had teachers that they don't have instructional technology degrees. There's whole degree programs, you know, in that field. But then taking it a step further, with children being in the home nearly 24/7, in the city of Memphis, there are roughly over 50,000 homes that have lead-based paint issues. So while students are in school, we think about them being safe, but being in home all day and not having that mitigated causes another problem. The other layer to that is with COVID, especially with toddlers, so children from 2 and younger, they didn't get lead tested for almost 2 years now, because it's like, okay, do I want to risk taking my small child to the health department, even at these satellite sites, to get tested? You know, is not necessarily a priority, especially if you have more than one child. So kids and parents, they got hit hard as well.
I think for me, it was seeing the social norms around the mistrust for the health community put on broadcast. It's a lot of people were hesitant, and a lot of people had questions like, what do I do? What is best for my family? How do I protect my family at this time? And it was a lot of questions of like, what is the right thing to do? And so it was a lot of, I think for me, I was able to see the medical community actually step up and say, hey, we are wanting to reach out to the Black and brown communities to let them know, like, we're here to protect you. We want to take care of you. Like, we're here to do our jobs, and like, let us do that for you and stuff. And so a lot of building bridges to make better communities and make better connections for Black and brown communities. That's what I saw a lot of, so yeah.
And let's focus specifically on quarantine. As a single Black woman entrepreneur, it was great in terms of self-awareness for me and checking on myself in different ways, but it also was very lonely, and I had to use that word very specifically because I was with myself all the time. In addition, there's so much data out there about women having to leave the workforce, working moms, a whole lot of dynamics changed for women specifically in that short window of being required to be at home. So what was you guys' experiences like there?
So I'm accustomed to traveling a lot. So I have a nonprofit. I have a traditional 9-to-5, but the nonprofit typically allowed me to go to either the DC area frequently, at least once a month, Baltimore, and Flint, Michigan. And so it dawned on me like, dang, what am I supposed to do with myself if I'm not traveling? And so it was a battle between, there are things that I should do, but just really not feeling like doing them. I started to feel unlike myself and not really feeling as ready to be super involved like on projects. So I really personally saw a major transition from a mental health perspective. Where it was cute at first, you know, like getting to work from home for those of us who could, but then it got really like, okay, now how long are we gonna deal with this? This is a lot, like I'm a lot. Definitely from a positive perspective, I mean like the most introspection, self-reflection that I've done in my whole life. But then at the same time, you had to deal with your demons. You had to battle with yourself and be like, ooh, child, you get on your own nerves. Like, sis, you know, but it was definitely a very eye-opening experience to really get to know myself in a way that I didn't know myself at first.
Yeah, I definitely have to agree with that. That rings true for me because when quarantine hit, I had to stop being here, being there, being every situation, being superwoman. No, you had to pump the brakes, sit down and realize, who am I without all these extra things going on in my life? Who am I without all these different roles that I'm playing in other people's lives, in the community and stuff? Who am I to myself? And like, I had to do a lot of soul searching, a lot of deep digging to realize like, this is who I am and this is who I want to be in the world without all the different layers that I play, without all the different layers that I hold, or without all the different masks. And I had to be real with myself and realize like, hey, this is the Catherine that I wanted to be out here. So yeah, I can definitely feel where you're coming from and all that.
Well, I'm completely different. I enjoy being at home. I'm more of an introvert anyway. So for me, being at home, it was like, okay, well, I can get used to this a little bit. But at work, it was very difficult because that feeling wasn't there, that touch, that hug, that love, that, you know, being able to just move freely, you know, and I do like to socialize, so I guess not seeing your friends mattered, but for me, being in the house, I'm in the house anyways, so I did get the opportunity to work from home or to be in the house. Like, it was still the same for me, except I couldn't go out socially, or I couldn't go to the grocery store like I was used to doing, or something like that. So not to say, you know, I didn't despise quarantine, but I did miss my friends a little bit, but I'm to myself most of the time. So, and I've seen that, I've heard people say, you know, I missed going out, I miss going to work, I miss being in the office. When I talk to my friends, because most of them live out of town anyways. So they're like, I miss going to the office. I'm like, I don't miss going to the office. Like, I gotta go to the office every day, so it didn't stop for me. But I did understand it. And then I heard people who were like me, it was like, you know, well, I enjoyed quarantine. Like, I enjoyed being in the house. So it's interesting to hear, you know, the different sides to it.
So let's talk the vaccine. I'm gonna add 3 buckets. If you forget one, let me know. But are you vaccinated? When did you get vaccinated? And what was your whole process on getting to that point? I will start very briefly because I want y'all to answer, but I am vaccinated. I got vaccinated late spring. I was last in my family because I was trying to let essential workers and, you know, the elderly, and then I looked up and my brother, who's 5 years younger than me, was like, oh yeah, I'm already good. And I was like, oh, okay, well, I guess I'll start. A lot of that loneliness and travel, like you mentioned, drove my decision. I travel a lot for work and for leisure. So that was a big driver. I also have a dad who is naturally immunocompromised. So just to be around him, I was going to have to get vaccinated. And I will say this is the caveat that I am a punk. Like, don't put me, if I don't have to be, whatever the annual checklist is, give me that and I'm gonna do the bare minimum. So if I feel like if I could get it, if I can honestly say like the prick is very small, like I appreciate Shelby County, let me just drive up. I don't have to go in a medical facility. Like all of that did really help. And I mean, the first dose was, I did get 2 doses. The second one almost took me out. It was a little different experience, and like the mind fogginess and just not being able to be 100% felt weird. But that was my vaccination experience, and I've been, evangelizing. I do think people should get it for yourselves, but I'm not a science head, but it's very logical to me on why we're supposed to be doing it. So what has y'all's, again, the 3 buckets. When did you get it? Dang, I forgot my own buckets. When did you get it? What did I say? Why? And then what are your experiences like? Yes.
So I can go. So I got my vaccination and I did the 2 doses. I also got it in the late spring. Actually, I am considered an essential worker, but I'm gonna be real. I was like, let me see some people get it first, and let me see how it work out for them. And then let me also pray about it. So there was quite a bit of reluctance. And then interestingly enough, like some of my family members so it was split. So some were like, as soon as I can get mine, I'm gonna get it. But then the other half was like, no, like I don't trust it. And so I was like, okay, I'm just gonna have to just get in my own personal space to make this decision. But what really made me get it is I went to Disney World. So I went to Disney World for my birthday. It was actually my first time going to Disney World. And I'm like, I am not about to go, number one, to Florida. And then to Disney World without a vaccination, it was about to be canceled. So as far as the experience, the first dose was fine. I was like sleeping. Now that was the most delicious sleep ever. Now the second dose, like even leaving off the parking lot, because I did the drive-through, I was like, no, wait a minute, do I have regrets? Like, what just happened? I know my arm, so I had COVID arm real bad. I was like, is it gonna go away? And then there was a strange reaction where it was very itchy at the site, like where the second dose occurred. But then it was nothing that that was unbearable. I was groggy and, like you said, just kind of spaced out for a few days. But I got over it fairly quickly. And then also because I was still able to work at that time remotely, at least like I was at home, like quote unquote recovering. But it wasn't the end of the world. I made it, clearly.
All right, well, I'm gonna be the one to say I did not get the vaccine. I have not yet been vaccinated, and I know that's like wowing to a lot of people for me to be in the field that I'm in, but I just haven't had enough evidence for it. I'm one of those. I have not had enough evidence for it. I hear a lot of the COVID arm and the paralyzation and all of that, and I don't like shots anyway, so I need a little bit more. Give me a little bit more so that I can understand it more. I understand what COVID is. I understand how it's contracted. I understand all of that. But vaccination, I'm not there yet.
Yeah. I know for me, it was the factor of quarantine, being stuck in the house, doing virtual school 24/7. It was being away from my family in Mississippi, and my grandparents, they're older, they're vulnerable populations, and I was tired of like just being away from my family. So at the first chance, I was just like, Shelby County, vax me up right now, because I can't be up in this house no more. And I wanted to live my life. I was tired of like just being stuck, and I was just like, immediately, as soon as it's available, take me through there. And I did as soon as it was available. And so I went to the Pipkin building, and they hooked me up, and I was gone. Yes.
All right.
So I guess this is a good transition too, after your comments. But let's speak specifically to our generation, millennials, and we can go Gen Z also, on what you think the hesitations or concerns are about getting vaccinated. I can say candidly too, around the summer of 2020, I masked up and I was outside. I would try to do outdoor venues, but I would be in clubs. The mask never came off. So I did, by the time the vaccine came around, I had already become comfortable being in crowds with the mask on.
Right.
Not to say, who knows, I didn't do the antibodies test. I don't know if that might be a reason why I felt protected and I never contracted it. But I do think that is a part of some of our generation's hesitation. Like, I've been outside. I ended up going outside in the pandemic, and now it's like, why would I get a vaccine? So what other things have you guys heard in terms of why people our age are not getting it or waiting?
It's probably because they don't believe in it enough. I mean, it's new, and for us, a lot of us, we need a lot more facts. We need a lot more research. We need a lot more evidence of this working, of this actually being a working thing. Because I can go get COVID tested, we COVID tested every week. Every single week, sometimes 3 times a week, because of what the ratio was, and every time it was a negative. So there's a lot of people who routinely get COVID tested, and they come up negative, and they're like, okay, well, if I'm negative, why do I need the vaccine? You know, if I can go get tested and see what my status is.
Something, and I don't remember who said it, from an intergenerational perspective, it made me think about like my mom. My mom is a quintessential boomer. It makes me think about like my dad, my grandparents, and they experienced things that maybe not to this degree, but like I think about swine flu and all these other different things that have come up throughout the decades. And so I think about how terrified I was, and my mom was cool in it. She was like, it'll be all right. And I'm like, girl, look at it, you're looking at CNN and all of that. And it was just really interesting to see older people's reaction. Like my mom, she was outside. Now she had her mask on, but she was just like, I'm gonna live my life. So that was kind of reassuring, where I'm like, dang, my mama, is out here living her best life. But I do think that because we literally, as millennials, we've never experienced anything like this. And I think, because of science, we're accustomed to seeing these sorts of outbreaks happen overseas, but for it to like come here and the immensity that it did, I would have never thought in a million years that it would have gotten that bad, and for the United States to climb so far up, with cases. But I really think that it is just novel for something like this to happen within our generation. And then the last thing I'll say is I know that we may have retired the word woke, but I also think that we are much more knowledgeable of just the distrust and just with the government. We as Black people especially, and Latinx folks, we have every right to not trust the government. We know about the things that happened, like with Tuskegee, for example. We know what happened with Johns Hopkins, for example. And so I think that also plays a role just with distrust, where it's like, I'm like not about that life with anything that's coming from the government. We have seen multiple instances in our lifetime. I'll bring up Flint, Michigan, for example. The government told them to boil water and do all of these things that actually went against what they were really supposed to do, that caused irreversible damage. That was recent, so I think that also plays into it as well, is it's intergenerational, where older people seem to be a bit more comfortable, but also intergenerational, where we understand how history has repeated itself, and we don't want to be that group that gets got, essentially, is I think what these younger generations are dealing with.
Yeah, I have to agree with you. It's a mistrust, and it's a very real one. We've seen throughout history in many different events, like you spoke about, where it might not have benefited us to trust the government. It might not have benefited us to trust the medical community. And so I can definitely understand why people might be skeptical of it. I can definitely understand why people might be like, let me check the facts, let me check the research, let me wait for other people to do it, let me do some herd immunity, and I'm gonna just step back and let y'all do y'all thing. I definitely understand it, but I think it takes the medical field, it takes the government, it takes those different entities to step in and provide the information and to provide some facts and provide the data as it comes out and it rolls out to let the people know, like, these are the changes that are being made. These are the effects. These are the results of what's happening by using the vaccines and stuff. And so that's what I enjoy seeing about the research that's coming out eventually and how it's rolling out. So yeah.
And so now I don't even know what to call this phase we're in because we're still in the pandemic. But you know, we have people vaccinated, some people are not. Now mask mandates are going away, some are coming back. Like in this normal, how are you living your life? Like for me, because I am vaccinated, there is, you know, times where I'm like right now, I don't have my mask on. But in certain settings, I'll have it on. Also, just I think I'm in a very like out of respect place. Like I'll walk into a public facility with it on and then decide if I'm going to take it off. Things like get my lashes and my hair done. I have it on because like just at this point, like why would I go back? Y'all are so close to me, and I didn't realize that in the past. Like you're literally breathing on me right now. So I'm gonna just keep the mask on moving forward. So like, what is y'all's new normal currently?
I would say it's the large crowds for me that still gives me heightened anxiety. And then like disbelief, like, dang, ain't nobody got no mask on? Is that safe in these streets? But in like closer proximity, I think when I had to physically go back to the office, a lot changed then with how I live my life. I'm like, listen, if I'm gonna die from going to work, I'm about to turn back up. We outside. We all the way outside again. You know, so that kind of helped to de-escalate it. But even now, that large crowd situation, that it still stresses me out just a little bit, because in a small setting with people who you're a bit more familiar with, that helps. Even like at a restaurant, it's like if you take your mask off, like you are like right, you know, near your tribe of folks that you're eating with. But yeah, that large crowd situation, especially depending on where you are, like for example, no shade to Mississippi, but it terrifies me because they've been living their best life almost the whole time. So if you like go over state line, I'm like, we gonna mask all the way up over here in these parts. But I'm kind of like you, it's a hybrid situation, but I'm about 90% outside.
I go out. I may not be very close because I'm a person who likes space anyway. So it's like, give me space anyway. Like I used to be in the grocery store and I couldn't understand why people would be all up on you like that anyways. It's like, you know, we need room regardless, whether it's a pandemic or not. So I don't know. I'm not out like that. I just visit my family and my friends. But traveling, I don't think like overseas travel, we would do that at all right now. It changed a lot because we had plans going to Africa and Bahamas and all of that stuff. And it's like, can't do that right now, vaccination or not. But I respect people and how they feel. I respect stores. If they want us to mask up, I mask up. I think I evaluate the situation. If it's going to be a lot of people in places, then yes, it's a mask there. It's always a mask. It's like the mask is your sidekick right now. You got to keep it in your purse. But outside of that, I just give people their space and hope people give me my space because that's how it should be anyways. But respect people's opinions. Like if I have to be around someone and I have a mask on, and you feel uncomfortable, then don't, you know, get upset because I have my mask on. It has nothing to do with you. Same as if I'm taking my trash to the trash can and I don't have a mask on, it's not about you. You know, I'm coming out of my house. This is my comfort. So socially, I don't think that I will be in that space to want to be in large group settings like that, but it's about respect. It's about respect of people's boundaries.
I definitely agree with y'all. Like, as I travel, because I'm originally from Mississippi, so I feel all of that. I'm going home. I'm the only one with a mask on. People looking at me crazy, like, girl, what is going on? But yes, I'm wearing a mask because I'm around people that I love who are vulnerable to this. I'm wearing a mask because I want to take care of myself because I want to be around too. I want to be outside too when the world is open up for real, because Delta variant is real. She is still popping out in the street, and you know, I respect her. I let her do her thing, and I'm gonna stay masked up until it's appropriate. Like you said, I'm gonna check the temperature of the room. Are the people wearing masks? Are we too close together? I'm gonna check all the facts and make sure and see, okay, it's appropriate here. Let me wear my mask and keep people safe and keep myself safe. So yeah.
And I guess just to wrap it all up, looking towards the future, I think we got to do a lot of this in every phase. You would be wishing what you hope the next phase look like. So let's do that a little more. What do you hope is coming next? I think for me, I just really hope a lot of the introspection, a lot of the work that people did on themselves, I hope that carries over. Especially for Americans, I really we really got to see how selfish we are as in our culture, and I just really hope that something sticks with us, because in situations like this, like if a pandemic can get us to worry about the person next to you, I don't really know what is. Going back to then in the Black community, it's like, where do we find hope if as a country we can't stand by each other, and I'm trying to get you to be an ally to my whole race? Like, I don't know what that's going to look like. So I know, Wendy, but what are you thinking or hoping for in the next, as we try to end the pandemic?
I would hope that people can evaluate themselves and be grateful for life, period, because a lot has transpired, and going into the next whatever is to come, I hope that we brought out of COVID the value of life, the value of the person next to you, or the value of your time, the value of being able to be free and go outside when you felt like it. Curfews came up, people couldn't go outside and things like that. So if people really were grateful for what we are able to do, I think that will help for the next phase, if there is a next phase.
I think for me, I would value people just being more health conscious. Like, everybody wasn't washing their hands before. Let's keep it real. Let's be honest. But making sure people, like, wash your hands, use some hand sanitizer. It's there for you to use, girl. Use it. Just being more health conscious and being more sanitary. I hope that that's taken way beyond now, and it's just not a trend for the moment, but it's a lifestyle. Like, stay clean, wash your hands, keep your 6 feet, girl. Like, give people their social distancing space. I hope that continues on, because I would love that 6 feet. Like you said.
Give me some room.
Give me 6 feet.
I would say that I hope that some of the changes that we saw in everyday life with technology, I really hope that that'll be here to stay. So as a quintessential millennial, y'all, please let us like work how we want to work.
Yes.
Why y'all making us go in this building? Honey, when we know for certain that we can do this at the house. Even if it was a hybrid, I'll say I'm a native Memphian, but I spent some time in DC, and they had been, flexing and doing hybrid work environments for a long time. And I would like to see places like Memphis come out of the Stone Ages, being that you literally have the capacity to create more flexibility. Let's come out of the Industrial Revolution and let's be like everybody else. I'd also say that there's a lot of creativity that came out of this whole moment. I think that, especially when we think about young people, about youth, like I know we kept talking about STEM all day, but no, for real, STEM. We've got to keep our kids engaged on how to tap into this field. If it were not for technology, like we really would not be able to operate. Like the usage of apps and all these different cool things that came out of an unsavory situation, I think brings forward like a lot of opportunity for especially Black people, for different ways that we can attain wealth outside of the traditional trajectory, and even where we tell our kids that, it's great to be a teacher. I was a teacher, a doctor, a lawyer, what have you. But now there's a myriad of things that our young people can do for life.
Well, thank you, ladies, for having this good
shot
talk. Good kiki. Brought to us by the City of Memphis and Blue Cross Blue Shield. Thank you guys again.
Thank you.
I'm Dr. LaTanya Washington, Physician Advisor at St. Francis Hospital, Memphis. As physicians, we know that what we do now will affect the future for us all. Memphis and Shelby County, get vaccinated. It's our best shot.